Hi, today's our topic is types of antibiotics and their generations. Firstly, an antibiotic was originally a material created by one microorganism that selectively inhibits another development. Since then, synthetic antibiotics have been developed that perform comparable tasks, typically chemically similar to natural antibiotics. There are number of effects of antibiotics on viral infection. The antibiotic classification with examples are the antibiotics that contain an original chemical molecule from a microorganism but are further altered or called semi-synthetic. For example, penicillin V, those made completely in a laboratory, are called synthetics such as cephalosporins. Antibiotics are further classified according to susceptible bacteria against which they are effective or their antibacterial spectrum. Some drugs called broad spectrum antibiotics have a wide range of effectiveness against both gram positive and gram negative bacteria. With broad spectrum antibiotics, it is uh, possible to eliminate pathogens without initially performing laboratory tests to identify the exact pathogen involved. So, treatment to identify the exact pathogens involved, other antibiotics are called narrow spectrum antibiotics. Now, the list of classification of antibiotics. While there are many antibiotic classification schemes based on the bacterial continuum or route of administration or action type, the chemical structure is the most useful. Antibiotics will normally exhibit identical trends of potency, toxicity, and allergic potential within a systemic class. The first is the penicillin. Penicillin V is an antibiotic in the penicillin group of drug which helps to fight bacteria in the body system. Penicillin is used to treat many types of infection caused by bacteria, an example of which is an ear infection during the stage of active replication. Penicillin G is bactericidal against microorganisms prone to penicillin. It works by inhibiting cell wall mucopeptide biosynthesis. The examples of penicillin are amoxicillin, ampicillin, penicillin G, penicillin V. Then next is cephalosporin. In wealthy countries, cephalosporin antibiotics have been a big part of the antibiotic formulation for hospitals. Every day they are recommended for a large range of infections. Their undoubted success is focused on lower risk of allergens and toxicity, as well as a wide variety of sports. However, it is the above attribute that allows microorganisms that are immune to these agents to be chosen. The examples of the cephalosporin are examples are divided into four generations. The first generation is cefazolin and cefalexin. Then the second generation is cefoxitin, cefaclor, cefuroxime, and the third generation is ceftriaxone, cefotaxime, and ceftazidime. And the last generation, that is fourth generation, example are cefepime. The next type of antibiotics are fluoroquinolone. The fluoroquinolones are certified antibiotics for serious life-threatening bacterial infections. As on all antibiotic products, official guidelines on the proper use of antibacterial agents should be taken into account. The examples of the fluoroquinolone are the FDA approved for fluoroquinolones include levofloxacin, ciprofloxacin, ciprofloxacin extended release tablets, maxifloxacin, ofloxacin, gemifloxacin, and dilafloxacin. These are the example of fluoroquinolones. Then next is tetracycline. Tetracycline has commonly been used to treat acne and lots of infection in the skin and also respiratory tract infection. It also known to be effective in the treatment of urinary infections. Since in the 1950s, tetracyclines have been used in the treatment of a large spectrum of gram-positive and gram-negative bacterial infections. In addition to being effective against typical bacteria, tetracycline and a number of non-infection diseases have been used to treat infection due to intracellular chlamydia, mycoplasmas, rickettsia, and protozoan parasites. The example of tetracycline are limecilin, methicillin, minoxidil, rolitetracycline, and doxycycline. These are the examples of the tetracyclines. The next is and the last is macrolides. Macrolides are often indicated for treating community acquired bacterial pneumonia because of their action against numerous causative organisms. Microbial resistance is becoming increasingly common. However, macrolides have been also used for the treatment of sexually transmitted infection caused by the chlamydia trachomatis. Macrolides are also used for skin and soft tissue infection caused by the staphylococci and propionibacter acne. The examples of macrolides are azithromycin, clarithromycin, and erythromycin are commonly used to treat infections like pneumonia, sinusitis, pharyngitis, and tonsils. So, these are the information related to the various types of antibiotics and their generations. Thank you so much.